Are there any other technologies out there that you are curious about, excited about, or maybe that you're intrigued by, that they've done something maybe groundbreaking or something that you really didn't think would come along?
Well, what I think is interesting right now is there's a lot of study in longevity, and there's, the full body scans and blood testing panels. What's exciting about that is people will be able to get ahead of things, and they'll detect so much earlier and be able to treat things before they get too out of hand. And so I'm pretty excited about that field just in general, like the longevity space, the preemptive care space. There's a lot of interesting things happening in the world of food science and diet and figuring out how diet affects your body, which also seems like a big duh because you eat food every single day, and of course it's going to affect your body. So those are the areas that I'm mostly interested in.
Longevity is something that obviously you hear more about, but sometimes I'm like, what does it really mean? I think there's a lot that goes with quality of life, but I think you touched on one of the biggest parts of longevity is we still have lacked personalization and actually preventing diseases. And so I think once we start to work more with actually people taking ownership in how they can help prevent a certain disease, that's coming in their life, whether it's due to family history or maybe just lifestyle. I think that there's so much to explore there. And I do think that we are starting to use technology as the tool to get people more engaged with their own health.
Exactly. And I love that platforms like Hims and Hers are almost giving consumers the education and the power to ask those questions too. I like what's happening right now with putting patients a little bit more in the spotlight.
On the Hims and Hers platform, what is your, I guess, maybe coming from when we think of conventional medicine where you always go to the doctor's office and you have to go to your appointment and wait 30 minutes in the waiting room. What have you seen in the telehealth industry that has really pushed healthcare into a different stratosphere?
Yeah, I think there's a few things. There is so much friction to going into a brick and mortar provider's office. You have to take time off work, you have to sit in the room. And telehealth just allows you to answer some questions while you're sitting there maybe watching TV, talk back and forth with your provider via the way you do other things like text message and, IMing. And I think it has reduced the friction to a point where suddenly people are thinking, well, if it's not bad enough for me to go into the doctor's office, maybe I'll try the telehealth. And so they are actually being treated for things that they weren't being treated for before. One of the things that surprised me early on in this company was how many people were coming in saying that they had never reached out for treatment, which meant we were helping a group of people that were not even asking these questions. And of course, part of that was also stigma, right? Like they didn't want to stare anybody in the eyes and say that they had an issue of whatever it is. And, there's some safety in being able to do it via telehealth. And so those two things, the convenience factor and the, destigmatizing or providing an avenue for people to get help, I think those are making a huge impact.
Oh, I definitely think the convenience and flexibility portion. I've had so many patients see me on telehealth, whether they're on a break or they're on lunch, and they'll go to their car and use their phone. Even people who will go to a different area of the office. And that's what I really think healthcare should be, is the relationship.
Exactly. And it's helping providers too. They can be a lot more efficient. They can set some of their own hours to be a little bit more flexible depending on what they need. And fresher doctors means better healthcare overall. So it helps a lot of things. And will it help everything? No. If you break your arm, go to the doctor.
But I think for right now, where we have gotten is formidable, considering, before the pandemic, we really weren't doing telehealth to the degree that we see it being done now.
Exactly. I'm just able to get treatment without having to go through all of this stuff and find a provider. Plus, a lot of people live in rural areas. Maybe they don't have a specialist around them. And so it's really providing access to a lot of people that didn't have it before. People would reach out to me and say, this is like a miracle. It's been a wild journey for the last 7.5 years, and it's just been so rewarding. So looking forward to continuing on and building on more and more treatment avenues for people, and
Stay tuned for more discussions like this with industry experts, and all in all, stay well, and we'll see you soon.